Hello, my name is Joyce Harper, Professor of Human Genetics and Embryology at the Institute for Women's Health, University College London. And as part of Global Women Connected, we thought it'd be good to make vlogs and blogs demystifying some of the articles that have been in the news at any one time concerning women's health issues. So this vlog is about the recent case that's been in several newspapers over the last few days, including Time, Huffington Post, Guardian, Daily Mail, Metro, lots of other newspapers, and it's the case of a school teacher, German school teacher, who's 65 years old and who's carrying quads. Now, this lady is single, she's 65, she's carrying quads, and she's already got 13 children and 7 grandchildren. Her children are from 5 different fathers, and her oldest child is 44 years old. The pregnancy is going to be documented for the German TV channel RTL. And what I'm going to do in this vlog is give you my personal view of why I have concerns over this particular case. Now, the first is that she's 65 years old. In natural conception, we would normally get pregnant up to about the age of 45 to 47, and that's really very rare. It's very rare to get pregnant naturally at that age, and beyond 47 really is quite a miracle to get pregnant naturally. And in IVF, our age is actually lower than that. It's about 43, 44. Again, we're very lucky to get patients pregnant at this age by IVF. So how can we get a patient who's over 45, 46, how can we help her get pregnant? Well, we can do this by egg donation. But with egg donation, the pregnancy rate will be the pregnancy rate of whatever the age of the donor is. So if we've got a 25-year-old donor and we put these embryos back in a 70-year-old woman, the 70-year-old woman will have the pregnancy rate of a 25-year-old. So one thing we have to be very careful about is only putting back one embryo from an egg donor in any woman, no matter how old she is, because there's a very high risk of her getting pregnant. Now, what about the age of the recipient? Well, in most countries, we set the age at about the age of 50. So, as I've said, getting pregnant naturally at 50 really is a miracle. So we're going beyond what would normally happen biologically. So the trouble with getting pregnant over the age of 50 is that there is a high obstetric risk to carrying and delivering a child over this age. So it really is just too risky and also not what would happen normally. Now, I know men can father kids at any age, but unfortunately that's the limitation we have with women. We're not just providing the DNA by the egg, but we've also got to carry the pregnancy. It's the obstetrics risks that really have to be taken into consideration. My second concern for this case is that she's carrying quads. Now, around the world, we're trying to work towards a single embryo transfer policy. Certainly in the UK, the HFEA that govern us want us to just replace one embryo. And it's very common, especially in Europe and also spreading out to many countries, to reduce the risk of carrying a multiple pregnancy, which again results in a lot of obstetric risks and also risks to the children not being as healthy as they would if we just delivered one child. So the one at a time policy is really now coming throughout the world. Now, I'm not sure where she had her treatment. I did try to find out, but I couldn't find out. In Germany, unfortunately, because of regulations about storing embryos, they have a policy where if you have 2 or 3 eggs, you have to fertilise all of those, and if they do fertilise, you have to put them back in the woman. So unfortunately, this gives quite a high multiple pregnancy rate in Germany and also some other countries. But egg donation, as far as I'm aware, it's certainly up until recently, I think it still is illegal in Germany, so I'm not sure where she had her treatment. So a multiple pregnancy at any age is an obstetric nightmare, really, but at the age of 65 is really a problem. And currently the oldest age woman who's given birth to quads is a 55-year-old woman who gave birth in 1998. So this woman, apparently, according to the press, she was offered something called selective reduction, and this is where in a multiple pregnancy, 1 or 2 of the fetuses can be terminated to try and give a better outcome for the health of the mother and also the resulting children, the fetuses that are left, that will hopefully result in healthier babies. But obviously that brings ethical concerns of doing a termination of some of these fetuses, and she apparently did not decide to go down this. She also used donor sperm as she was single, and there's no discrimination, certainly in countries like the UK and many other countries, about the treatment of single women, which is great. But age has to be taken into consideration. We have to consider the welfare of the child, and are there going to be people to help look after if there's no father there? Who's going to help look after the children if anything happened to the mother? And I suppose in this case, hopefully her 13 children will be helping out. But I personally just wonder what her motivation was to do this. She's 13 children and 7 grandchildren, and she's 65 years old. Obviously she loves children and she's a teacher, but really bringing 4 children into the world at this age, I think we have to think really, was this the best thing to do? And now I'm all for letting people make their own choice in their life, and I don't think we should tell people what they can and cannot do. But the trouble with this is that this is involving a third party infertility. In this case, she went to an IVF clinic, and the IVF clinic were the ones who performed this procedure and resulted in quads being carried by a 65-year-old. And having worked in IVF for over 25 years, we obviously have to have rules and regulations of what we can and cannot do and what is ethically acceptable for us to do. And cases like this do not give IVF a good name. I think most people would probably agree that this was not good treatment that was being offered to any woman. So we need to think about what we're doing in IVF. We need to think ethically. The new technology is being brought in all the time, and I've made a vlog about that recently. We need to think that we are doing things that are ethically sound and that fit with the rules and regulations of where we are performing our IVF treatment. Now, I'd really like to hear your comments about this. We've already had great discussions in the last couple of days on our Facebook page, Global Women Connected, and in early May we'll be launching our website, globalwomenconnected.com, and we'll be having all of these women's health issues that come up in the press discussed on our website and our Facebook page. So I'd love to hear comments from you. You can either put comments after this YouTube video or on the Facebook page, or you can email me, joyce.harper@ucl.ac.uk. Thank you very much.